Hi, this is Dr. Dean Kelaita with a Calaveras Health Officer update for COVID-19 this week, the week of August 25th, 2020. Several developments have happened this week which would require a little bit more detailed discussion. Statewide, throughout California, COVID-19 cases continue to increase. California has reported 668,615 confirmed COVID-19 cases with 12,152 deaths. This disease rate continues to increase not only in California, but in Calaveras County as well. Calaveras County Public Health has now confirmed 197 coronavirus cases, and now with 2 deaths in Calaveras County residents. The most recent death was reported in a Calaveras County middle-aged female resident who was hospitalized in a neighboring hospital in the San Joaquin Valley. This was reported to us on Friday, August 21st. So now this is our second death in Calaveras County. If you remember, our previous death was in a individual from the Copperopolis area. If disease rates continue to increase, we can predict further fatalities as well. To top things off, also in the last week, an outbreak of COVID-19 infection in Avalon Skilled Nursing Facility in San Andreas continues to escalate. The skilled nursing facility initially identified a case of COVID-19 infection in an asymptomatic staff member who was working in the facility. This was picked up through routine testing that's being performed periodically on all of the people who work in the facility. So part of this routine surveillance testing sequence identified this individual on July 27th. So since that time to date, today, there have been 19 residents and 11 staff members identified as confirmed COVID-19 cases in the facility. These people are being picked up either because they get sick and they go to the hospital, or they're picked up through enhanced testing that's being performed on all residents and all care staff at this point. Any positive residents that are identified are being temporarily transferred to another Avalon facility outside of the community, outside of the county, which has been designated just for COVID-19 patients. This is a specific nursing home outside the community where those patients can be placed together in what's called cohorting. And so residents from our facility will be transferred there until they're recovered to the point where they can be able to come back to prevent ongoing transmission to other residents within the facilities. The facility's infection preventionist, the infection prevention staff of the nursing home, has been working closely with our public health department, and we've also been in contact and consultation with the California Department of Public Health Licensing and Certification Branch and healthcare associated infection specialists to get technical assistance and guidance on how best to manage this outbreak. The facility is undergoing close surveillance for the next several weeks, and through regular testing weekly, we will be able to identify promptly any new cases that are identified in the facility. Those individuals can be isolated right away, and ongoing transmission can hopefully be prevented from continuing to occur inside the facility. But this is a significant development in our community because, as we've discussed, the skilled nursing facility, the nursing home, contains a very high-risk population that we want to protect. very much as a priority. There's currently 4 Calaveras County residents who are hospitalized, 3 at our local hospital, 1 outside of our community. Local hospital capacity remains adequate to handle the COVID-19 cases that are coming up, and ventilator capacity is at 75%. Remember, ventilators are medical devices that assist people in breathing when their lungs are impaired by COVID-19 infection. On August 13th, 2020, Calaveras County was placed on what's called the state monitoring list. The California Department of Public Health maintains a system to monitor counties on several parameters, what are called metrics, that indicate elevation in disease transmission and that track hospital capacity for being able to take care of patients. For example, how many COVID-19 patients are in your local hospitals, how many ventilators are available, and what's been the percent increase in hospitalizations in every jurisdiction. Because Calaveras County was experiencing an increase in the rate of new infections per 100,000 population for more than 3 consecutive days, that made Calaveras County go on the state's watch list, the state's monitoring list. Now, once counties get on the monitoring list, there are several additional business sectors that require closure. And in Calaveras County last week, we had announced that there were several other business types that were required to be closed. These included business activities such as indoor gyms and fitness facilities, personal services such as tattoo parlors, massage parlors, body art studios, as well as barber shops and hair salons. Those are just broadly considered personal services where close contact among patrons and the practitioners is significant. Additionally, schools that were planning on resuming in-person instruction now cannot move forward with that for the new academic year at this time. Once counties are able to be off the monitoring list for 14 days, then schools may elect to resume some kind of on-site or in-person instruction if they choose to do so. Now, on August 20th, 2020, Calaveras Public Health confirmed that the California Department of Public Health had allowed Calaveras County to be taken off of the county monitoring list. So we were only on the monitoring list for 7 days. However, now that counties are off the monitoring list, those specific business activities and business sectors that were required to be closed must remain closed at this time. There's a specific process that the county, that the state is reformulating that will allow businesses on the counties that have moved off the monitoring list to reopen again. Industries, so basically industries or activities that were required to close unless they were able to be modified to operate outside or by pickup delivery type services must remain closed. So I think that's an important point for people to understand, especially for those engaged in those business activities, because that can be disappointing. After 14 days off the monitoring list, schools can elect to participate, as I said, back in online, in-person education. So kids coming back into the schools if they elect to do so. Most school districts are opting for an exclusive online instructional program for the first semester to see how the COVID-19 situation shakes out in our community. As I alluded to, the state's in the process of reevaluating when businesses required to close can be allowed to reopen. Last Sunday, over the weekend, we participated on a conference call with California Department of Public Health staff and were informed about the re-evaluation or revamping of the state monitoring list program to go into a little bit different system where counties won't just be put on or taken off of the monitoring list. There'll be a more nuanced and a more detailed type of monitoring program where there'll be several different tiers, and counties can be placed on these different tiers, which will allow for certain types of business activities to hopefully start to resume again. In counties like ours, where we haven't really been on the monitoring list for that long, and our metrics that we're graded on to put us on the monitoring list haven't really been that far out of compliance with what the state is interested in. So right now, that businesses being able to resume that have been suspended are being reevaluated, and that's yet to be determined at this time when those businesses will be allowed to resume. As I've said in the past, the best ways to avoid exposure to the COVID-19 virus that causes so much illness during this pandemic are to stay home if you're sick, stay at least 6 feet away from people outside of your household. That's known as social distancing or physical distancing. Washing one's hands with soap and water. Hopefully, if soap and water is not available, then antibacterial hand sanitizer product can be used. Washing hands for at least 20 seconds has been shown to help kill virus on contact with the skin surface. Avoid touching your nose, your eyes, and your mouth with unwashed hands. This could allow the virus entry into your body, resulting in infection. And to wear a face covering over your nose and mouth when around others, especially if physical distancing is not allowed to be taking place. That makes face coverings even more important during those times where you can't maintain proper social distancing. As a reminder again, no-cost testing is available in Calaveras County. So no-cost testing for COVID-19 is available for anyone who'd like to be tested. The OptumServe test site is located at the Calaveras County Fairgrounds, Frogtown, and it's open from Tuesday through Saturday from 7 a.m. to 7 p.m. The best way to use the testing site is to register ahead of time by using their website, where you can put in your name and some basic demographic information about yourself. They give you a code number that you then use to access the result of the tests when they're available, and you tell them how you want to be contacted by email, by text message, by phone call. So people are highly encouraged to register ahead of time online to be able to access the test site more expeditiously and more efficiently. People without internet service can call the toll-free number 888-634-1123 to receive information and resources related to COVID-19 and the website address and the toll-free telephone number that I just mentioned, in case you weren't able to jot it down real quickly, can be accessed by looking at our county COVID-19 website, where those contact numbers are listed. We must remain cautious in how we move forward. To continue in a positive direction, the public is urged to really continue to wear face masks, to keep 6 feet apart, to wash hands, and to get tested for COVID-19. If you feel sick, if you're exposed to someone who's sick, if you're exposed to someone who's been diagnosed with coronavirus infection, it's really important to get tested, because that information can guide what you do and how you prevent exposing others. Gatherings where physical distancing can't be maintained, people should be wearing a mask and face covering of some kind. There's no doubt that our current situation is further strengthened when we use these basic tools, when we follow these basic directives, when we work together to help in the fight against COVID-19. All of us in our community can make an impact, we can work collectively together, and we can get through this pandemic. For further information, please visit our website, and the Public Health Department will be releasing additional information as part of our press releases on Tuesdays and Fridays. And I'll be releasing information in the ways that we're doing today on a regular basis, especially as new information becomes available. So thank you for your attention. Let's continue to fight to keep our community safe, and we'll be talking more in the near future.